Traeger here again. Just wanted to touch base and follow up with you guys after our 9-month appointment here. You know, the purpose of the well visits really is to make sure that all of your questions are addressed. So we consider that to be the most important part. And because of that, sometimes we spend some time talking about those things and we don't hit all the developmental things that I was hoping to touch on in the appointment. So that's what these videos are for, to help kind of recap on some of those things. Also, you know, this age is a lot of fun, and sometimes not all the parents or grandparents, people that want to be there, are able to make it to the appointment. So you can show them these videos and hopefully they can get some of the flavor of what we talked about during this visit. Okay, so now that we're at 9 months, and I know I probably say this every single time, but this is fun, right? This is the age where things have really started to pick up and be a lot more enjoyable. You know, some people are like baby parents. They love infants. They love newborns and stuff like that. And that's true. We like to snuggle with those little guys. But at 9 months is when you really feel like this is where you're off in your stride. And you're busy and you're kind of tired still because now we're running around all the time. And that's okay. That's okay. We'll talk more about that here in just a little bit. So now that we're 9 months, at 9 months we check everybody's iron level to make sure that they don't have low blood counts, and we also check their lead levels. Here in McLean County and most of Illinois actually is a high lead zone, so we check everybody's lead and their iron to make sure everything is okay. We'll also do that again at 18 months, so that's what the little finger stick thing was for. If it's a problem, we'll let you know about it right away when that happens. The other thing is at 9 months, solid foods and eating should be a lot of fun. Now again, we're still breastfeeding, we're still formula feeding. Keep doing what you're doing. There's no reason to decrease unless the baby's really not wanting to eat it very much. And really very few babies are increasing the amount of breast milk or formula they're taking at this time. So 4 to 6 meals a day, breast or formula, whatever you're doing, that is great. But when it comes to solid foods, we should be doing lots of things. So 3 meals a day, 2 snacks throughout the day, and really whatever you want to give them. So just don't choke them, and nothing unpasteurized still, so no honey, stuff like that. But by 9 months, I really want you to have tried yogurt, and I want you to have tried scrambled eggs, and I would like to have peanut butter and stuff like that. Do fish, do things like that. Have fun with it, okay? A wide variety of foods at 9 months is great. And what's really cool is at 9 months, they're gonna be feeding themselves a lot more. So 4 months kind of grab with their 4 fingers or their whole hand like this. 9 months will start to grab with 3 fingers, okay, and start to pick things up and wanna feed themselves. So let them pace themselves. That is okay, all right? So if you're trying to come at them with a spoon and they're saying, then fine, put it on the tray and let them do it. Now, they make a mess, then we're all done, okay? You are not you're not a custodian more than anybody else, okay? So if the kids start taking it and dropping it and feeding it to the dogs and stuff like that, then you can do that. Sorry, extra credit thing here. So we, with my first one, you know, I remember it was like Thanksgiving time, and they're at the grandparents' house, and we're like looking around, and we're like, man, our kid is never this messy. What is going on? 9-month, 12-month-old is crazy. And they say, what are you talking about? You guys have a dog. And we're like, oh yeah, the dog cleans it all up. But again, if the kid starts dropping it and feeding the dog, just stop. Just all done, we're done. You don't need to make a big mess with that stuff. Kind of cute for pictures, but messy to clean up and stuff. So yeah, and then they're going to the bathroom, a whole bunch at this point, which is great. You know, hard poops, we get concerned about that, but lots of pee, lots of poop. And then at 9 months, the sleeping is still really good. Okay, so at 9 months, starting at 6 months, no reason to feed at night, but at 9 months they're sleeping all night long, going to bed a little drowsy, but that routine kind of kicks in where they're just used to going to bed. So you go to bed, it's great, it's really good. And then they wake up in the morning. Now at 9 months, a lot of kids will sleep regress a little bit. They'll start to wake up on their own, starting to talk in the middle of the night or kind of be restless. Don't feed them. Don't feed them. Don't bring them into your bed. Don't bring them in your bed. Okay, so the baby's crying, let them cry for a couple minutes, see if it's the real deal. Go in there, change, put them right back down. A lot of people at 9 months, they come to the doctor because we're worried that their ears are hurting them or something. We say, nope, everything's fine. Normal sleep progression at 9 months. So just kind of tough it out. That'll be okay. And things will start to get back on routine a little bit. So let's say your baby's not sleeping through the night at 9 months. Okay, you'll hear me say, dude, we need to push them a little bit. And we're gonna push them even harder at 12 months and 15 months. We want to stop this because at 9 months, they're still contained in their little crib, okay? So they're maybe moving around and stuff in there, but they're not out. So what happens when your baby's 15 months, when they're 18 months or 2? And now they won't stay in their crib. So they wake up at 2 in the morning and they say, I'm gonna go make a sandwich. And they jump out. And then next thing you know, they're in the kitchen getting in trouble, or even worse, they're in your bed, okay? So we need to make them sleep through the night. Again, you have to do it before you go to college. So might as well fix it now and just go ahead and go for it. The other thing is, at 9 months, we should be brushing those teeth if they're there. If you don't have teeth, that's okay. No big deal. Teeth will come sometime before 18 months. And if they don't, that's fine. We'll address that if we get there. But at 9 months, start brushing the teeth if you want to. You can use regular baby toothpaste. You can use regular adult toothpaste, including the fluoride. That little bit that's in there is not going to hurt them one bit. So let them chew on the toothbrush. Just do your best. My kids, I really struggled with this. We really had a hard time getting in there and brushing their teeth, so we don't want to fight that fight. It wasn't worth it to us, and it may not be worth it to you guys too, but I'm supposed to remind you to do it at this point. And then the other thing is, at 9 months, routine is king, okay? These guys love a schedule, and so if you can say consistent bedtime, consistent nap time, consistent meal time, they're gonna love it. They're gonna be really good. Now, baby number 1 gets great routine. Baby number 2 gets less. Baby number 3, forget about it. You're running around with everybody else. So just try and protect those times that are important, especially sleeping time. We like that a lot, which is really, really good. So remember, at 6 months, the baby loved everybody, smiling, laughing, having a great time. 9-month-olds are like that too, but separation anxiety, stranger anxiety is much, much, much more common at 9 months, and that's okay. That's normal, okay? So it's really common for the baby to, like, you're in a new situation and someone comes in the room, watch, what will happen? The door opens up and the kid will first look at them, and then they'll look right at you and they'll say, hey, Dad, is this guy cool? And then if Dad's cool, then we're cool. And that's good. So the way you behave, the way you act towards people are usually gonna make the babies transitioning and things like that go out better. So we're dropping off at daycare. Last week they were totally fine. Now we're dropping them off and it's like, forget about it. That's okay. You gotta go to work, drop them off, leave. It's okay. It's okay, all right? Those things will go away pretty quickly, but just consistency and just kind of ignoring those things when they happen. When you leave and go to another room, different parenting style. Parent to number 1, you can say, all right, hey, I'm going to the other room. The baby will follow you in there, or they won't. That's fine. And they'll just cry. You'll be back, okay? Or some parents put them in the sack and they carry them around the house all the time. It's okay. Whatever your parenting style is, we're not going to beat you up about that at all about that. So at 9 months, developmentally, there's a lot of really cool things going on. They should enjoy being played with. They should be singing. They should have a great time. You should be able to turn the book of a page and just turn, and just have a good time with it. That's really, really cool. But at 9 months, we should be kind of indicating to you, hey, I want to be picked up. That was so cool. You come into the crib in the morning and the baby's sitting there, arms up. Hey, pick me up, Dad. That's really cool. And that's great for 9 months. They should be able to make the noises, mama, dada, but not specific. And remember, you have all of 9 months to do that. At 12 months, mom and dad plus one word, and they mean it. But at 9 months, just making the noises, there's what we care about. They should like to play peekaboo. They should like, games like all big, all done, so big, things like that. And copying some of your noises that you're making. Now at 9 months, most kids will actually grab onto something, your hands or the bed rail, and they will pull themselves up to stand. Very few kids seem to just stand in the middle of the room, just stand up, but they will grab onto something at 9 months. And if we're not doing that yet, we want to practice. So you can kind of lock their feet down and kind of tug them a little bit, and then they'll kind of like water ski themselves up to help kind of stand up. That's a big deal. Once you start doing that, usually crawling is going really well by this point. And then this is the age where they start to like bang on things. So if you want to, you totally be that parent. I'm totally fine with this. Where you say, all right, we have a drawer in the kitchen where the baby can go in and they can grab some pots and pans or some Tupperware. Just have that Tupperware there. And you say, fine, this is where they go. They climb in there, they grab it, they start banging things together. It's super cute. But we need to make sure that everything else is baby-proofed, okay? Because they're gonna pinch those fingers. They're gonna grab something they're not supposed to. So baby-proofing the house at 9 months is a super big deal, which is really cool. The other thing is just safety with the kids at 9 months. They get in everything like we talked about, but make sure that we're not leaving them alone in the car, not alone to play. It sounds like common sense, but guys, you need to make sure that the baby's not in the back seat when you get out of the car. We need to make sure that we are not playing in the bathtub alone or alone where they can fall downstairs or climb on something and things like that. So this is the age that you have to start being really intentional about it. Most parents, you won't admit it to each other, but so many of you guys come in because the baby rolled off of something or fell or banged their head or something, and it's common. It's really common. So just make sure that we don't get any serious injuries from things like that. And then the last thing at 9 months, which is a lot of fun, is that this is the age where discipline, tantrums, frustrations, things like that start to come in. So you're going to find that you'll tell the baby, no, or hey, I'm doing this. And they'll start to get upset with you about it. So what you can do is you can be that parent if you want and go in there and oh, it's okay, and things like that. Or you can be like, no, these are the parameters in which we're allowing you to operate in, and we're not changing it, okay? I know you want this. You're not getting it. That's okay. There's nothing wrong with that. And really, it seems like at 9 months, man, that must be early to talk about. But tantrums start at this age. And one of the first ways that these tantrums start to identify themselves is mealtime, okay? So you're going to feed, and it's on the spoon, and the baby wants to grab, and and they want control of it. And you can decide. You can say, all right, fine. You're feeding yourself. We can make a mess. That's cool. Or no, I'm feeding you. You're going to let me feed you. And if they refuse, then you say, all done, stop. And if they start to refuse the feeds, then it's all done, stop, okay? Because you're showing them, no, I'm in control of this here. And there's going to be times where you're in control, and it's okay to use no. It's okay to tell them, no, you can't climb on this. No, you can't get in that cabinet. Those are all fine things to do. But what we don't want you to be is the guy who's sitting there, no, we want you to actually get up, okay? We would love you to go and say, and you pick them up and you say, no, you can't be here, and you dump them someplace that's safe for them to be. And then there's gonna be times where you can't entertain them, and they're gonna get upset, and you're gonna say, okay, dude, okay, cowboy, let's go. Let's get in the crib and let them cry. That's fine, okay. A little bit of isolation for those things is totally fine. And if you can start working on those things now, kind of those behaviors, then it's gonna be a lot easier when things get a lot worse. People talk about terrible twos. No, it's not terrible two, it's before that. We're gonna get to there. A really fun game to play that my wife and I used to is that, when the kids are asleep and we're talking, we say, hey, this is coming. What's gonna happen when the baby does this? How are we gonna discipline him? What if we're at the store and the kid drops to the ground? I remember having that conversation, like, there's no way our kid is gonna drop to the ground and throw a fit in the store, and we're gonna be embarrassed and wanna smother him with attention. And then it happens. It happens to you. And it was nice to have a plan ahead of time. So just kind of think about those things that are coming. Or it's fine to watch other parents and other kids and be like, man, when that happens to us, I hope we don't respond that way. I wouldn't give them advice. I wouldn't be like, hey man, you need to knock that off. But you just for your own kids, kind of think about it. So yeah, so 9 months is great. Hopefully you're having a really good time. The next time we'll see you guys is at 12 months. So when you come in for your 12-month appointment, you have to be greater than 12 months of age, because there are some age-specific vaccines that we get at 12 months, and we'll talk about those when you guys come in. Okay, thanks a lot for your attention, and hopefully you're enjoying this age, and we'll see you in 3 months. Good job, guys.